A long-term care home in Ontario is grappling with a major outbreak. Almost 200 residents and staff have tested positive at the Tender Care Living Centre. And family members have raised concerns, claiming residents weren't getting enough water or medication due to the lack of staff. The CBC's Hilary Johnstone is following this story for us. Hilary, what's the latest?
Hi, Natalie. Well, a really concerning situation that is unfolding inside this long-term care home. It's in Scarborough, which is in the east end of Toronto. And family members, so people who have loved ones living inside, have expressed a lot of concern about the conditions their family members, their loved ones are living in. And then we've also heard from physicians in recent days, so doctors who've been inside and have actually assessed patients who live at this home, who have even taken to Twitter to express their shock at what they've seen on the inside. We know that there have been concerns that some residents might not be getting adequate water or medication, that there aren't enough staff to be properly taking care of everyone that's living inside. And we're still waiting for updated numbers today to see how many residents and staff have tested positive. But the latest numbers that we have from yesterday are 116 residents who are confirmed to have contracted COVID-19 and 77 staff members. That is a total of 193 people. There are also 39 people who have died. And North York General Hospital has been called in to try and help bring this outbreak under control. They have sent teams of staff, so doctors, nurses. They've also sent personnel to try and deep clean this facility. They've appointed a senior manager to oversee the outbreak. And in recent days, we've heard from the executive director of Tender Care, who has said that part of the problem they're having is that the level of spread in the community is now so widespread that it's seeping into the home. So that's something they've pointed to. They've also said that they've had problems hiring more staff members to make sure that there are adequate staffing levels inside the home. And in recent days, we've heard from Toronto Mayor John Tory on this. He called it a tragic situation, and he was actually asked whether the military should be sent in. And of course, that's something that we saw in long-term care homes in the first wave of the pandemic. He said that long-term care homes are for the most part under control of the province, so that he was waiting to see if anything more was going to be done there. We also know that the province has ordered a review of the home, and once that's done, it will be made public. Natalie?
Thanks, Hilary. That's the CBC's Hilary Johnstone in Ottawa. And for families of the loved ones inside that nursing home, the worries continue today. Jessica Wong joins us now. Her grandmother has been recently tested positive for COVID in that care home. Jessica, first of all, let's talk about your grandmother. How is she coping today?
We weren't able to speak with her for a while. So yesterday was the first time we were able to do a video chat with her since December 13th. So prior to that, in between, there was a lack of communication. Yesterday, we were able to talk to her. The nurses say that she's not showing any signs of symptoms, but unfortunately, mentally, she seemed very unstable. Her behaviors were not normal. She seemed extremely fidgety. She was moved to a different room by herself, so she's completely isolated right now, but none of her belongings are with her. She's facing, 4 white walls. She's very in and out when we're talking to her and not as comprehensive as we were hoping her to be.
And I know that you and your family had been hoping to get your grandmother released so she could come and be with you guys and out of that facility, but she has tested positive, as you said. What's happened since then?
Well, since she's been tested positive, it's risky for us to take her out at this time, for both her and for my parents as well. So since then, now it's just been checking up on her symptoms. And if she's okay and not showing any symptoms for 10 days, her case would be assumed resolved. And then we're going to reconsider at that point.
And I know she's been at this facility for quite some time. Life, we know, for many seniors in these nursing homes right across the country is very different than what it was like. How has it changed her experience?
Well, since the outbreak, my grandmother is a very social person. She loves to go and talk to people. She loves being there. That's her home. But now she's being separated from everybody. She doesn't really know what's going on. There's a language barrier there. So with new staff coming in, we can't be picky about whether or not they can be Cantonese speaking staff. So she's she's scary, and it doesn't feel like home for her right now.
Did she tell you she's scared? Is that something that she expressed to you?
Yeah, she had said to us yesterday that she wants to go on holidays right now and come out.
That's very hard, I'm sure, for you and your families. I know that families like yours are coming together to try and help each other, trying to cope. What has that support been like for you?
Well, prior to this woman who reached out to me, she's a stranger in the beginning. She reached out to me through Facebook. And if it wasn't for her, I would not have known about this outbreak. I would not have been able to try and communicate with my grandmother. And she was able to recruit a lot of different families and find them and build this support group. And now a bunch of us are trying to build this group together, and we're using each other to exchange information because there is such a lack of communication at Tender Care. Even the other day, just last night, one of the women who has her mom there was asking our group if anybody in our group is going to talk to Tender Care or has communication with them to help put her mother to bed, because she is unable to get a hold of Tender Care, and that just shows the lack of staff that there are there.
And what's it like for you to hear these stories, to speak, luckily, with your grandmother yesterday, but to hear the condition that she's in, that she is scared, that the staff are struggling, that you, as you said, that woman who you spoke to who needs some help for her mother to get into bed. What's it like for you to be on this side of this and then hearing these stories?
Well, it's heartbreaking. It's terrifying to know that, from the first wave, we already knew that this was very much a possibility, that this spread could have been prevented if the proper measures were taken. We've been, waiting. This is 8 months, and now we're in the second wave, and we knew that this was coming. So all the families are feeling extremely helpless. The more people that are being included into the group, the more stories that I hear, it's feeling more and more helpless. But, even the ones that have lost loved ones are joining and continuing the fight to get more staff and to get more medical care, everything that is possible at this point.
And knowing that, what would you like the government, if they're listening, watching this, what do you want to say to them?
To bring in immediate help. We cannot wait any longer. We've had 3 to 5 deaths in the past week every single day. COVID does not take a holiday, and we need the help right now. We need to bring in military. We need to bring in medical assistance.
Well, we know that is something that the government talked about during the first wave in Ontario. They said, the Ford government, they were going to put a ring around long-term care homes. Do you feel that, from your perspective, more needs to be done? Would you like to see that help once again?
Yes, more needs to be done, because right now, Tender Care is they're doing their best right now, and they're looking for directions. They're looking for, leadership. And usually they go off this list of directives, protocols that they need to follow. But we need a plan B if plan A is not working. So, for example, as of December 18th, they were still testing staff every 5 days. And 2 days on top of that, because that's how long it takes to get the results, that's a whole week to wait for a positive or negative result. If that's the case and that's not working, then what is plan B? Right now we're doing 3 days, but is that enough? That's still another 5 days waiting. So when something like that happens, we need to have another plan in place.
Well, thank you so much, Jessica. Jessica Wong's grandmother lives in the Tender Care Living Centre in Toronto.
Thank you.